guys on the large intestine, what are they called? Those are the house strip, okay? And running mid-ventrally, that's the tene coli, okay? The tissue that keeps the coils together, that's the mesocolon, okay? So on this guy, this would be the appendix, right? The green would be the remainder of the ileum. And then you would have ascending colon, transverse colon's missing, descending colon, sigmoid colon, and the rectum, okay? For pancreas on a stick, where is it? No, there's one that has the two of them right here.
Here.
Yeah, that's it. Okay, so pancreas on a stick, guys. This is the pancreas, and this is the pancreatic duct, right? Okay? What's the green guy in the back? Common bile duct. And the pimple in here, ampulla of Vader. Okay? So look, don't spell it that way, though. Yeah. So, take a look at these models after the movie, guys, okay, so that you review them, and it'll help you tomorrow as well. Okay, on the liver, big lobe is the right, the smaller lobe is the left, the one with the inferior vena cava is the caudate, the tail of the liver, guys, okay? Caudate starts with a C, cava starts with a C, okay? So this is the caudate lobe with the vena cava, and then here, right beside the gallbladder, the four-sided one is the quadrate lobe, okay? All right, all these green guys are hepatic ducts, right? When I come looking here, okay, this is the left hepatic duct, this is the right hepatic duct, this is the common hepatic duct. Going to the gallbladder, this is the cystic duct, okay? And then when CCK is released, this guy squirts and the bile is delivered, okay? All right, so on our head here, this is the sublingual and that's the submandibular salivary gland, okay? Yeah, and the parotid's on this side or right there, right? Okay? So y'all should have a head that, there he is, okay? He's still put together, all right? So y'all have one in this room too, okay? This is also a really good model for the nasal concha, and the auditory tube opening is, somebody has inked it in pencil, so it's real clear.
Don't do that.
Don't do that, yeah. All right, on this model, who's the green guy? That's the lacteal for fat absorption. And this whole structure is known as the villus, and the brush border here is the microvilli. Okay? Can you think of anything else that we need to do? The Gall's intestine for the mesentery and the greater omentum. Oh yeah, we need to. No, yeah, this is good. Okay, back. This is not the one I want. I want the intestine, not the large intestine. It looks like this, but it's, no, I want the small intestine from the girls. Oh, right here. The membrane that keeps the small intestines together is the mesentery, right? Whereas, remember, guys, we call this the mesocolon. Okay, mesentery, mesencolon. And the fat apron that sits down across the intestine, that's the greater omentum. Okay? On the teeth, yeah, I'll take this guy. All right, so what kind of broken tooth is this? What kind of tooth is this, guys? It's a molar, right? Also known as a tricuspid. In the other room, you have an incisor, okay? So make sure you look at both of them because you don't know which one's going to be on the practical. The part of the tooth that's above the gum line is the crown. Down below, the root. What's the covering of the crown? Enamel. Down here, cementin, and on the inside, it's dentin, right? And this is the pulp going into the pulp cavity. Okay? All right, and from what we said this morning in lecture, remember your incisors are for grasping, canines are for tearing, and your molars are for crunching and grinding. Anything else we didn't do? I think we got it all. This is a good villi model too, right? Right, we can ask this too. Okay, the ridges are the villi, right? And on this one it's a yellow vessel. Okay, that would be the lacteal. Okay? So tomorrow, guys, what we'll do is review with you guys the urinary system and the reproductive system models. And these you should go back and look at before you leave today, because it will help with tomorrow's exam, because you'll have a good visual picture. Okay?